I'm going to conduct my abdominal assessment. Initially, I'm going to inspect my patient's abdominal area for symmetry, making sure that there are no lumps, bumps, erythema, ecchymosis noted on my patient's abdomen. I am also assessing for contour, so I'm going to inspect from 2 different angles to make sure that my patient's abdomen is flat. So I am identifying that my patient's abdomen is flat. I don't know any pulsations, heaves. Next, I'm also looking at my patient's skin to make sure that it is even and normal for my patient's race and ethnicity. I am noting that there are no scars from any previous surgeries or surgical interventions, and as noted earlier, no bumps noted. I am also assessing for any pulsations in the aortic region, which would be midline, and I don't know any pulsations. Next, I am going to auscultate before I percuss and palpate. So I'm going to divide my patient's abdomen using the umbilical region as a middle point, dividing my patient's abdomen into 4 quadrants. I'm going to start in my patient's right upper quadrant and move in a clockwise manner. I will auscultate the abdomen for approximately 2 to 5 minutes. To provide myself sufficient time to auscultate bowel sounds. At this time, I am auscultating normal active bowel sounds in all 4 quadrants. I'm going to go ahead and listen again just to make sure I cover all areas of all quadrants. You can rotate in a clockwise manner twice as I am doing, or you can individually listen to each quadrant in multiple locations. So again, I'm noting normal active bowel sounds. While I have my stethoscope available, I'm also going to listen to the aortic region to be sure that I don't hear any murmurs or bruits. And there were none noted. So next I'm going to percuss my patient's abdomen utilizing the same 4 quadrants. I'm going to start in the right upper quadrant and rotate in a clockwise manner. And typically you would hear in the abdomen region, you would hear tympany or tympanic sounds. So I'll gently place 2 fingers over the patient's right upper quadrant and I will percuss. Noting the difference in sounds and in relation to patient's organs. However, typically you will hear tympanic sounds across the entire region of the patient's abdomen. Prior to palpating, I will ask my patient if they have had any pain or tenderness in any area, because if they did, I would want to palpate that area last. Have you had any pain or tenderness in your abdomen? No upset stomach? Okay. Please let me know if while I'm palpating you have any pain or tenderness. So I'm just using light palpation over all 4 quadrants. To be sure there are no heaves, masses, bumps, tenderness. And that is the end of my abdominal assessment.